By now, a lot of you may have heard the New York Times put out an article today that Allergan, the maker of Botox, Juvederm, and also breast implants, that they're taking off a certain type of implant. They're taking it off the market. And I want this video to reassure everybody, it's not as bad as it sounds. And also, if you missed this IG Live, we're going to repost it on IGTV. But what I wanted to clarify is that the type of implant that Allergan took off the market was a textured implant. So it's an implant sort of like this with this texturing. And the idea with texturing is it keeps the implant from moving. Whenever I put an implant in, I make a pocket small enough to where it doesn't really move. Now, if it's a round implant like this, if it spins, that's fine, it's no problem. Even if it's textured or smooth or whatever, if it spins, not a problem. But with a teardrop or a shaped implant, the idea is that it's fuller on the bottom, and then if that turns, then you've got a sideways boob. So that's why texturing is really important for teardrop or shaped implants. So anyway, so that's the texturing is what's in question here, and it's the texturing that's specifically associated with Allergan implants. That texturing has led to a certain type of lymphoma. So not really a typical cancer. It's not the type of breast cancer you normally think of, and we've talked about this in other IGTVs and things like that. But the type of cancer that's associated with the Allergan textured implant is called anaplastic large cell lymphoma, ALCL. It's like an overgrowth of lymphatic tissue. And whenever you get any type of implant, saline or silicone, your body naturally forms scar tissue around that implant. Even when you get like a knee implant, like a total knee replacement, your body develops scar tissue around those implants. So that part, not unusual. But if the scar tissue gets really thick, that can lead to something called capsular contracture, which that's when it deforms the breast. And that's still not cancer, but that may require you to go in and cut out that scar tissue. But then in a very, very small percentage of cases, that scar tissue that naturally forms around the implant, that can turn into lymphoma, which is just this overgrowth of lymphatic tissue. And that seems to be happening more with the Allergan shaped textured implants. And the way to treat that is you go in, you cut out that scar tissue, that lymphoma, and the patients typically are cured. There have been some reported deaths, but that's usually was years ago before they even knew that this existed, and nobody really knew how to diagnose it. Now it's much easier to diagnose, because the way you would know if you had this problem is that, one, you got an Allergan shaped or round textured implant, and then you would notice, like maybe years later, all of a sudden one breast would get bigger. That was because you formed this seroma or fluid collection around the implant. It would just be like all of a sudden this big change. You'd go to your doctor, they'd draw off some fluid, they send it to the lab would see that there was a specific protein in that fluid, and then they would know you had anaplastic large cell lymphoma. They'd go in and cut out the scar tissue and you'd be cured. Again, years ago, before they even knew this was going on, they were late to diagnosis, and that's maybe why some of those people died. But nowadays, it's a much quicker diagnosis, and you can be cured. So that's, again, with Allergan shaped or round textured implant. If you have an Allergan smooth implant, saline or silicone, you're fine. They really haven't found any evidence that ALCL occurs with smooth implants. I actually don't use Allergan implants, so if you're a patient of mine, you don't have anything to worry about. I've used Sientra in the past, textured and smooth, and I've used Mentor, textured and smooth, and I still would use those. I'm still comfortable with using those, even in my own family, because they really haven't seen any evidence of that happening, except for a very low percentage of time. And it's something that you can spot pretty quickly nowadays. So hopefully that allays anybody's concerns. If you have smooth implants of any kind, you're fine. If you have textured implants by Mentor or Sientra, you're probably still very much fine. But if you have any questions, you can come in and see me. We can do a checkup on you annually if you have any concerns at all. But also keep in mind that even though Allergan has voluntarily recalled and taken off their textured implants off the market, the FDA is still not telling patients with those implants, they're not telling them to go and get your implants taken out as soon as possible. So just kind of keep an eye on your implants if you have those specific type of implants, but the FDA is not requiring you to get them taken out. If you're not having any problems with them, if you're not getting the sudden swelling of your breast on one side, then you don't need to rush and get those implants taken out. So hopefully this helps. If you have any questions, direct messages, and if you missed this in the next 24 hours on IG Live, like I said, we'll put it on IGTV. Let us know if you have any questions. Thanks for listening.